At the start of the vaccination programme, the UK made a pledge to supply all the overseas territories with the vaccines that were needed to ensure that all the population of the overseas territories, as well as the population in the United Kingdom, were able to be vaccinated. Gibraltar managed to get itself organised very early on by identifying a significant amount of people to be able to help deliver the vaccines, and as a result of that, as a result of the success in being able to get vaccines into people's arms without wasting a single dose, then the UK has been able to deliver vaccine to Gibraltar to ensure that the programme could run at pace.
Given the fact that a large percentage of Gibraltar's adult population has been vaccinated and received their second doses, Gibraltar's become a bit of a test case for the world to see the effectiveness of a vaccination program in a COVID world.
Yes, so Gibraltar has now vaccinated somewhere in the region of 85% of the adult population, which is clearly right up there in terms of the percentages anywhere in the world. And as we know, we haven't seen a single case of COVID in the adult population of Gibraltar, the resident population of Gibraltar, for some 4 weeks now. So it would seem to be quite clear that the vaccination programme is having a huge impact. It is quite noticeable to walk down Main Street, for example, and to see life returning very much to normal here in Gibraltar, and that's definitely a beacon of hope for the rest of the world.
You were recently credited in a press conference with having been instrumental to the vaccine program here. What exactly has been your role?
Well, Minister Sacramento was very kind indeed, but I've been one cog in the machinery that's helped deliver the vaccination programme here in Gibraltar. There's been a tremendous number of people from the Ministry of Health, from the Gibraltar Health Authority, and indeed volunteers from all over Gibraltar that have come together to run the vaccination centre here at St Bernard's Hospital, to run the vaccination centre at the ICC, the team that have been working in ERS. They've done a magnificent job. On a peak day, they delivered over 1,300 vaccines to people who are living in Gibraltar, which is just purely staggering. My role has been to help coordinate that, to ensure that we've been able to keep the spreadsheets up to date, looking at how many vaccines we have in the freezer at any one time and matching that to the appointments that people have been booking, to liaise with the UK in terms of the delivery of the vaccine, because colleagues in the Foreign Commonwealth Development Office and the Department of Health in the UK have been liaising in terms of how much vaccine we're likely to be able to use and when. So it's really been more of a coordinating role that I've fulfilled.
Can we expect vaccination programs to become a frequent thing, an annual thing perhaps?
I think it's too early to say yet, that the research is still ongoing. We are starting to think about preparations for a booster, but as yet it's far too early to say whether or not a booster is actually going to be required. But in terms of proper planning, the right thing to do is to plan for it, and then if we don't need it, we can step it down. Much better that way than to head into the autumn and then suddenly realise that we need to put plans in place.